Biggest township turned serious and deadly very quickly. Driver who tried to make a quick getaway has been cornered with the car chase over and the suspect in the back of the van. More arrests were made.
We are not going to allow people who are going to challenge the authority of the state at the expense of the lives of disciplined citizens of this country.
Traders without permits having their goods confiscated.
We're not stopping people from trading, but they must do it within the confines of the law. So the most important is to tell the nation that they should stay at home so that the curve can be flattened and then this COVID-19 situation can actually end.
Welcome back. Well, the antiviral drug Remesdivir that was originally developed to tackle Ebola is now, according to reports, is showing some promise for treating the novel coronavirus. American scientist Dr. Anthony Fauci has reportedly said an early trial shows Remesdivir can reduce recovery time. Earlier on the agenda, I spoke to the chairperson of the South African Health Products Regulatory Authority, Professor Prof Rees, about whether we should be getting excited about Remesdivir as a possible treatment.
Well, I think whenever we get any clinical trial that shows promising results, it's very exciting because at the moment, as you know, we don't have a cure and we don't have a vaccine. So this was a well-done study, I understand. I haven't seen the full script, but I've read some coverage. So it was well done, and what they showed was that by putting people on Remesdivir who were in hospital and were seriously ill, they could reduce the time in hospital from 15 days to 11 days. What's not as clear yet is whether it also will have an impact on reducing deaths.
Releasing preliminary data, Professor, on a clinical trial like this, is that unusual to you, or were these results, these prelim results, so significant that it had to be released now?
I mean, in the normal sort of way that we do business with clinical trials and the way we look at results, we usually wait until we have what's called a peer-reviewed paper. That means that the science has all been done, it's been written up, and it's been considered and thought to be good enough for publication by people's peers not involved in the study. Now, these are not normal times. We are looking all the time, and the World Health Organization is looking all the time at data that's coming out from trials as quickly as it comes out.
Right.
So before we have, the publications, people will look at the data, look at the quality of the trial, and obviously the scientists themselves are trying to publish as quickly as they can, and all the journals and online journals are putting the data out there as quickly as it can be done.
Professor, I've been reading a lot about a specific plant on social media. What do we know about the plant Artemisia? Reportedly in Madagascar, there's an Artemisia-based herbal drink which is aimed at preventing and treating COVID-19. Have you heard anything with regards to this?
Yes, it's obviously getting a lot of attention because obviously it's got a lot of support in Madagascar and is being rolled out into the communities. So Artemisia is, you're right, it's a plant, but it's a group of different plants, but it's been known for many years to have an impact for treatment of malaria. And the Artemisia-based medicines that we use were originally from the molecules that were grown from those plants. And they're obviously modified in their formulation in medicines, but that is still a very widely used product in the treatment of malaria. So we know that it works in malaria. And what we're doing in the world generally is that we're looking at all the drugs that we know about. There are groups of people, there are dictionaries of drugs, and people are looking at all of these drugs and saying what looks like it might work to help COVID-19, either protect from infection or treat. And so the anti-malarial drugs are being looked at. We're also looking at chloroquine and hydroxychloroquine as well, and this would fall into that category. But at the moment, we don't have any definitive data that would allow us to say that Artemisia as a herbal product is effective. There hasn't been a clinical trial that would allow us to definitely put our hands on our hearts as scientists and say that this works.
How far, Professor, are we from getting a vaccine? Is it still the 12 to 18 months that we were talking about a couple of weeks ago?
Well, I mean, a couple of weeks have gone by, so things have moved. There are more now vaccines in